Lincoln, we're with you. And let's see, on the line with us from the urology group, Dr. Steve Kappa. How you doing?
Yes, I'm doing well, Lincoln. It's good to talk to you again. I know we had a chance to talk about this exact topic actually recently on the importance of PSA screening, prostate cancer screening for men, and here it is in the news, in the national news, regarding our Secretary of Defense.
Yeah, I'm wondering, what do you think happened with him? And I guess he got treatment for prostate cancer, but something happened. What do you think happened?
Yes, sir. Well, the first thing I'll say just up front to you and to your listeners is it's very difficult for us, outside of the immediate treatment team, his surgery, his doctors and his nurses there taking care of him to comment on exactly what happened. I'm just relying on what the Pentagon has released and what the media has reported. So take all this with a giant grain of salt.
Yeah.
What has been reported is that he was treated for prostate cancer. They describe a minimally invasive procedure, removal of the entire prostate. So what they're referring to, what the Pentagon is referring there to, is a radical prostatectomy procedure. This is a very common treatment that we give for men who have prostate cancer. And the fortunate thing that's described here is that it was found early, suggesting that he was screened appropriately and that he was treated successfully from a cancer standpoint. Now, the reason this is in the news is, unfortunately, he experienced a complication and had to be hospitalized after returning home from this surgery. So, this is all over I know, Lincoln, you've probably seen this is all over the news. There's a lot of confusion. And obviously, Secretary Austin has a very important position in our government as Secretary of Defense. So, this is a big deal. He was in the ICU. They reported that it was a urinary tract infection or complication, and that there was some fluid in the abdomen. Again, I'm working with very limited information, but I can comment generally, what most men experience after prostate cancer surgery and what may have happened here. But it sounds like he had primarily an infection. That's what made him so sick and resulted in his hospitalization in an ICU.
Now, you say he had his entire prostate removed? Is that what you're saying?
Yep. Okay. That's what the Pentagon statement says. That's what's been reported. Yeah, he had what's called a radical prostatectomy for prostate cancer.
So actually, I guess it wasn't caught early, right? I guess if early detection, he wouldn't have had to have the complete prostate removed, would he?
Well, that's actually a great question. It's a great point. Not necessarily. Actually, what happens sometimes when we screen men who are at risk for prostate cancer, and again, as you and I have talked before, just to remind your listeners, we really encourage men starting around age 50 up to the age of at least 70, and then beyond that for men who are in good health to go to your doctor, go to your primary care physician, get an appointment with the urologist, get a PSA, and get a prostate exam yearly. That may have been the case with him, and it doesn't mean it was not caught too late necessarily. Actually, a lot of times we catch clinically important, significant prostate cancers and then do a big surgery or radiation treatment to prevent that from spreading. And I hope that's the case with Secretary Austin. Again, I don't have any follow-up information from him, but because he had prostatectomy doesn't mean it was caught too late. Actually, and a lot of times that means it was caught in time to give him a successful treatment and a prostate cancer cure.
Wow. Well, to me, just having the whole prostate removed, now, what does that do for your sex life if that has to happen? What does that do?
I have
to ask these questions.
That's a great question. I want to, again, first emphasize that there are, of course, side effects to all treatments, but I can't tell you enough how important it is to get screened, to see your doctor. Even though some of these treatments do have side effects, they are life-saving. So what we don't want to see, there's a small percentage of men, but prostate cancer is the most common most common cancer in men, and African-American men are particularly at higher risk. And so you can really intervene on them with appropriate treatment. Sometimes that involves surveillance, but then sometimes it involves surgery. I was not ignoring your question because there are sexual side effects to a lot of these treatments. But the good news about that is that we have effective treatments for erectile dysfunction after prostate cancer treatment. So it does happen. I tell my patients, I just had this conversation here in our office with the patient that, when you have prostate cancer surgery or radiation, a lot of times you'll experience some urinary and sexual side effects. Actually, most men do. The degrees vary a lot, but I encourage them to say, whatever we deal with, our number one goal is prostate cancer cure, and then the side effects from these treatments, we're equally committed to addressing those and to maintain the best quality of life we can. But we can't maintain a quality of life if we are dead from prostate cancer. So I tell patients, let's really focus on treating the cancer as best we can, the least invasive way we can possible. And the good news with our treatments is they get less and less invasive over the years. We have a robotic approach, so there's robotic surgery that has less blood loss and less complications. And so men actually do a lot better than they did 10, 15, 20 years ago when we did more open surgery. So we've made a lot of advancements, and a lot of advancements, too, with nerve-sparing techniques where we try to preserve as best we can sexual and urinary function in men who undergo prostate cancer surgery.
Because a lot of guys think, like, if I can't do the sex thing, I don't have any reason to live, so forget about the prostate surgery, you know? That's what they say.
I hear that, and I treat men who don't have prostate cancer with erectile dysfunction. I understand that's an important part of their quality of life. We're committed to treating that as well. And I tell patients again, fortunately we have successful treatment strategies to address erectile dysfunction after prostate cancer treatment. So I would definitely not let that be a reason. Number one, definitely not a reason not to get screened and checked, right? Because that doesn't commit you to any treatment. You have that discussion with your doctor. You guys decide together. You weigh the side effects of the different treatments, and you choose the best one for you. And my job is to help guide patients through that process, taking into account the quality of life concerns that you're mentioning.
Did they ever figure out why it affects black men more than white men? Did they ever figure that out?
No, that's a great question. We talked about that last time, and I said we know that the outcomes are unfortunately worse, and that the incidence is more frequent. And so we don't have, an easy explanation for that. We have a lot of variability among races with different cancer outcomes, and it's an area of intense research focus. And one of the ways that we can, I think one of the practical ways we can change that gap, change that disparity in outcomes, is to ensure that all of our patient populations get access to screening, cancer screening, and you and I were just at that event. Remember the black and white cancer event together, and that was the main emphasis from those cancer survivors, is getting access to screening and getting access to appropriate treatment where that screening leads. So I think that's one way we can address that disparity, but I think it's also more complicated than that. We don't have an answer yet, but there are a lot of really talented, smart, dedicated researchers working on that to better serve those patient populations.
All right. Well, it's always great talking to you, and I'm sure we'll talk again soon, one of these days. But everybody needs to get that PSA. And is there actually a need for the digital rectal thing if you do a PSA? Why is that even necessary if the blood is going to tell you everything you need to know?
Well, again, another reason I don't want to discourage men from seeing your doctor, because you have to get a prostate exam. They're really not that bad. But what I'll say is there's a little bit of debate about this. I always offer it to my patients because it does give you good information. Sometimes you can diagnose a prostate cancer from a prostate exam. And that's an important, so it's one of many tools we use. You mentioned the blood test, the PSA, absolutely critical. We also have imaging, MRI imaging, that's very helpful. So I like using every tool we have at our disposal to get the best information we can so that we're taking the best care we can of those patients.
Now, is it possible for your numbers to go up and then go back down? I thought once they were up, they were going to stay there. But is it possible, do you have one time you get a blood test, it's up, and then next time it's down?
Lincoln, you're asking great questions. I have patients ask me this all the time, too. And we do see some variation, right? So one blood test is not what's important. You look at trends over time. Now, obviously, if it's way out of the normal range, we usually act on that PSA with a biopsy. But sometimes you can see fluctuations up and down. That's why when we get a result, we say to a patient, I think we should recheck this, and instead of in a year, maybe let's recheck it in 3 or 6 months. So you will see some variation, but the bottom line is the prostate can get bigger with age, the PSA will go up with age, and we just want to make sure it doesn't go beyond a threshold that makes us concerned for prostate cancer.
Yeah. All right. You've answered some questions for us today. We appreciate it, Dr. Kappa. And we'll talk to you again soon from the Urology Group.
Yeah, no, thank you for this. And obviously we wish Secretary Austin well in his recovery. And, hopefully his story, even though he's had a tough time with this treatment, informs more men about the importance of prostate cancer screening and treatment.
That's for sure. That's for sure. Thank you for talking with us today.
No, you're welcome. Thank you. I appreciate it, Lincoln. Bye.
All right. Appreciate it.